This tablet is a combination of vitamins and iron, which is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks of the body. It is important to take this medication as directed by your doctor to ensure you are getting the proper dosage for your specific needs. It is best to take this tablet with a meal to help with absorption, and it is recommended to take it at the same time each day. If you have any concerns about the dosage or timing of this medication, be sure to consult with your healthcare provider for personalized guidance. When taking Central-Vite 18 mg 400 mg tablet, it is best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all directions on the product package and not take more than the recommended dosage. You can take this medication on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water, unless your doctor directs otherwise. If you experience stomach upset, you may take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication because they may decrease its effectiveness. After taking the tablets or capsules, do not lie down for at least 10 minutes. If you are taking the delayed-release form or extended-release capsules, swallow them whole and do not crush or chew them. Taking this medication regularly at the same time each day will help you get the most benefit from it. If you experience constipation, diarrhea, or an upset stomach while taking Central-Vite 18 mg 400 mg tablet, don't worry. These effects are usually temporary and may go away as your body gets used to the medication. However, if these effects persist or worsen, it's important to contact your doctor or pharmacist. You may notice that your stools turn black while taking this medication due to the iron content, but this is not harmful. Your doctor has prescribed this medication because they believe that the benefits outweigh the risks of side effects. In fact, many people using this medication do not experience any serious side effects. While it's rare, a very serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical attention immediately. This is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. And remember, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to keep Central-Vite 18 mg 400 mg tablet out of reach of children, as accidental overdose of iron-containing products can be fatal in children younger than 6 years. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. This medication is used to treat or prevent low iron levels in the body. It is often taken with vitamin C to improve its absorption. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before taking Central-Vite 18 mg 400 mg tablet, it's important to let your doctor or pharmacist know if you have any allergies to its ingredients, as some inactive ingredients may cause allergic reactions. Also, inform them about your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver or stomach/intestinal problems. If your brand of multivitamin contains folic acid, make sure to inform your doctor if you have vitamin B12 deficiency before taking it, as folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia. It's essential to consult your doctor or pharmacist for more details. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using this medication. Now, let's talk about how to use Central-Vite 18 mg 400 mg tablet. It's important to be aware of any potential interactions with other medications you may be taking. This includes both prescription and non-prescription drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't make any changes to your medication dosage without consulting your doctor first. Central-Vite 18 mg, 400 mg tablet can affect the absorption of other drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications from your doses of Central-Vite 18 mg, 400 mg tablet. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, it's important to inform your doctor or pharmacist if you take certain anti-seizure drugs. Also, keep in mind that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using Central-Vite 18 mg, 400 mg tablet. If someone has taken too much of Central-Vite 18 mg, 400 mg tablet and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contacting a poison control center is crucial. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Central-Vite 18 mg, 400 mg tablet, do not share it with others. It's important to keep all medical and lab appointments. Some brands of Central-Vite 18 mg, 400 mg tablet may also contain ingredients such as docusate. If you have questions about the ingredients in your brand, ask your doctor or pharmacist. Remember that Central-Vite 18 mg, 400 mg tablet is not a substitute for a proper diet. It is best to get your vitamins and minerals from healthy foods. Maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are taking Central-Vite 18 mg, 400 mg tablet on a prescribed schedule and happen to miss a dose, simply take it as soon as you remember. However, if it's close to the time of your next dose, it's better to just skip the missed dose and take the next one at the regular time. It's important not to double the dose in an attempt to catch up. This may cause unwanted side effects and is not recommended. Always stick to the prescribed dosage and schedule to ensure the best results from the medication. It's important to store Central-Vite 18 mg, 400 mg tablet at room temperature, away from light and moisture. Be sure to keep it in a safe place that's out of reach of children and pets, and don't store it in the bathroom. When it comes to getting rid of this medication, don't flush it down the toilet or pour it down the drain unless you're specifically told to do so. Instead, properly discard the product when it's expired or no longer needed, and you can always consult your pharmacist or local waste disposal company for more information on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.